The CMHA for me is about being a lead provider and advocate for mental health services in the community.
They understand mental health issues in the community, and they are in lots of places where people don't really even know that they are.
They represent that full continuum of care for mental health services, and that ranges from case management, justice support, vocational services, housing, primary care, and more.
So the vision of CMHA is mentally healthy people in a healthy society.
Where we're involved in the crisis at the front end, the hospitals perhaps are on that front end with emergency care, where the Canadian Mental Health provides all of the support at the back end, the ongoing programming that they provide here, the ongoing support for our police officers that require their assistance. So really, it's the sustainable piece in the whole mental health piece is the Canadian Mental Health Association.
And when we think about building the mental health system for Windsor-Essex, we believe that together we can create a seamless continuum of service for patients and family members that are experiencing mental health issues and are on the road to recovery.
And for some, it's a long-term, lifelong journey. And so at any one of those transition points, CMHA wants to be there, to be able to wrap around the individual needing support, the necessary services to carry them through to a better place of wellness in the end.
Our investigators on a daily basis, again, with the court system and the assistance from the Canadian Mental Health, we get some great results and some long-term sustainable plans for those who are engaged or are suffering from mental health illness.
At hospice, we're dealing with families that are going through a difficult time as they're losing their most prized loved ones. And, we just want to ensure that they have good bereavement services, especially for their children and for their family members, so that they can cope with their loss.
And sometimes a loss causes one to really struggle, and that's a time when CMHA can bring that particular program to wrap around someone who is working through some complex grief.
People cope and grieve in different ways. Some people move through that very quickly and don't need a lot of support, but others need a little bit more. And I think that that's where CMHA steps in and provides that expert counseling and supports people through that journey.
We've been collaborating for a number of years, but our latest collaboration about increasing the bereavement services is really a step forward into providing more complete care for the families that have suffered the loss of a loved one.
I think we have an assumption that people inherently know where to go to access services, and it couldn't be further from the truth. The system is very difficult, it's complex, we have so many different avenues one could explore and so many dead ends in those avenues. And so we need an organization that can be a one-stop shop for people to recognize as being an expert in providing services, but also that linkages to all the other care that exists. And an important component of that is social determinant. So we think about healthcare services, but we also have to think about all the other elements to one's life that helps them to feel whole.
The other important area I think that we'll be moving more and more into is in social housing, working with the City of Windsor to provide housing for people that maybe are on the streets, have mental health issues. And the first step in their rehabilitation is to have a place to live.
That need for people to have that basic element met in order that they can tackle their wellness and their mental state. The housing is a key component of that. And so we'd like to see CMHA over time grow that strength and be a leader in the community in terms of supporting their clients with accessing safe housing.
Having meaningful work is part of a service that we will try to help an individual work through, so that even though they may have a mental health challenge, that they're managing, that they can find a productive place in society. We have the wonderful luxury of having a community health center that's part of the CMHA.
In our healthcare center, we take into consideration the determinants of health, all the complexities involved in their care to provide holistic health care. We provide primary care to people living in the catchment area, this downtown catchment area, as well as anybody in Windsor-Essex County with a serious mental illness. The advantages of having city center health care in the same building as CMHA as one of their programs, I think it helps to provide seamless care. If they are in crisis and if they are having issues, we can go right across the hall. Most of the time we're able to contact one of their community support workers. If they're not available, there's always a client advocate. So the resources are right here in one center.
Well, I think one other important element to talk about as part of mental health is a commitment to take away that stigma that we tie to it. And that we should try to think about this as brain health, as health for our mind. That's as important as health for the heart, health for the kidneys, that it really truly is another element of keeping our bodies healthy, and in this case, our mind healthy.
The LIN, the Local Health Integration Network, has a mental health strategy and a strategic plan. CMHA is integral to that, as is Hotel du Grace Healthcare. There's a lot of people that are talking about a new hospital system here in Windsor-Essex. We're part of that, and mental health is a big piece of our development. So here on this campus, we are bringing the acute beds from the Willette campus here and redeveloping the downtown, the Willette Avenue site. We're going to be doing that in a way that's going to create a mental health anchor program. CMHA will be with us along all of the developments. They are integral to that.
We also need to think about ways we can grow our services. So how can we take the capacity we have and use new and emerging business practices and technology to expand our access and ability to serve more and more people.
Partnership will actually change the map a little bit as we go forward, because we'll be able to create new opportunities to go into service offerings that haven't been there before.
And we're looking forward to some of the exciting opportunities that we have to redevelop the mental health and addiction services in the Windsor-Essex community.
So, if Canadian mental health wasn't here, there would just be so much more suffering.
The gap would be too big for us to fill in. There's nobody else that would come to the table in the role that Canadian mental health plays.
You'd be left to your own devices to sort out where to go, what needs you might have in order to continue that path of recovery.
Increased criminality, increased health care at the emergency level, an increase to victimization in our community.
You would see the homeless rates go up as well. A high number of those that are homeless do suffer from mental illness.
Having a community agency like Canadian Mental Health that can take some of the strain off of that system, deal with people right at the beginning.
We acknowledge that we have a good hospital system that that catches people when they fall down. But after they have that initial help, they got to go back home and they got to start a life and maintain a life.
When there's mental health issues, it's Canadian Mental Health that's calling us all to the table to see what we can all do to help.
There is no mental health system without CMHA working in the community, and I think people need to understand better what it is they do.